Hi, we're live here today in New York City for the 72nd session of the United Nations General Assembly. We have with us today Loyce, President and Executive Director of Global Health Council.
Hi, good evening, everyone.
Hi, Loyce. Thank you so much for taking the time to be with us today.
Of course, happy to.
Yeah. So, can you tell our viewers a little bit about what is UNGA? Essentially, what is the United Nations General Assembly and what is happening in New York City this week?
Sure. Well, the UN General Assembly is a time when the world's leaders get together, and it happens every year, actually, and a lot of us come to New York to participate in these sessions kind of on the sidelines. And so you have the world leaders coming together in New York to debate or discuss a number of issues across the board. You know, if we think about the United Nations, it was put in place to help build peace around the world and stability, to address humanitarian issues. And so there are a range of concerns that people might have across the community. And so we're kind of here to listen in to what the world leaders are doing and saying and kind of hold them accountable for all those commitments.
Yeah, wow, that sounds great. So can you tell us a little bit about what global health community has to do with it?
Yeah, so global health is important when it comes to those discussions because I think we at the Global Health Council really see health as being fundamental to how the world progresses. You know, you think about security issues like, say, Ebola. That was really something that the world leaders were concerned about, and it was obviously squarely a global health issue in addition to touching all of these other areas like the world economy. And so I think it's really important for global health stakeholders to show up at the UN General Assembly and really kind of keep abreast of what the dialogues are like as it relates to health issues and try to even be a part of those conversations or otherwise inform the decisions that these world leaders are making as it affects the work that we care about.
Yeah, okay, wow. That's really amazing. So, as a global health community, and for our viewers who are in New York City today, how can they join the conversation with us?
Well, you know, I think what's really valuable is our online network. And so while we have a lot of people here in New York attending various events that you can find all about online with our special events calendar. We also are active via our social media platforms like Twitter and Facebook and the like, and so people are able to follow us online. I'm sure there are a couple of hashtags that they can find with regards to UNGA. I know UNGA 72 is one we're using this year to mark the 72nd General Assembly. We also have the Global Goals hashtag that has been used for a number of years, and so people can obviously follow GHG and see what we're up to, even if they're not able to be here in person. And again, that's important because then it helps this whole week feel less exclusive, ideally. A lot of people think about what happens here, if they even know about what happens here, and they feel like, oh, okay, that's just for a small subset of people. But ideally, more and more people around the world will start to understand what happens because, again, it will impact everyone, the decisions that are made here this week and in the years to come, especially if we're thinking about the Sustainable Development Goals and the targets that, again, the world leaders have set for the year 2030, including health and well-being. The whole global community has to be a part of that discussion. And so we'll do our part to try and ensure that people in our community really understand what's happening and just keep them informed. And again, try and bring their stories to the discussions this week as well. So I hope that we can do that with the conversations that we're having.
Yeah, and I hope you can help us too by following us on Twitter at globalhealth.org and following us on Facebook on our Global Health Council page, and go to our special events calendar, www.globalhealth.org/special events, to find out all about exciting UNGA health-related side events happening in New York City this week. So great, thank you, Loyce, for taking your time out of your busy schedule to be with us today. Thank you so much.
I'm happy to, and thanks to our community for being a part of Global Health Council.
All right,
bye guys.
Thank you.